My name is Danny Giovenco, and I am an assistant professor here in the Department of Socio-Medical Sciences at the Mailman School of Public Health. And I received my Master's of Public Health degree and my PhD in Public Health from Rutgers University in New Jersey. When I was in graduate school studying public health, I was never really interested in tobacco use as a topic. I soon learned that it's still the leading cause of death in the United States, which is pretty mind-blowing to think about. Realize that if there's a health issue where I can make the most impact in reducing death and disease, it's tobacco use. And I study the role that the tobacco industry plays in encouraging tobacco product use. So I study how products are marketed in communities, the different tactics that the industry is using. The Lerner Center faculty members, many of them focus on health communication and health education, how to convey health risks to the public. And the work that I do often focuses on what our opposition is doing. So what kinds of messages is the tobacco industry promoting to community members? And I think studying that is important to learn how we as a public health community can combat those messages with accurate health information. In my opinion, the greatest public health challenge is misinformation. So we live in an era where most people have access to the internet, and that's a blessing, but it could also be a curse because a lot of information is available, but it's not always accurate. So I think we need to do a better job at educating community members about appropriate sources of health information. That can make a really positive health impact if we know that the information we're getting is real news. I've been very fortunate because over the past 2 years, I've worked with 2 amazing Lerner Center fellows. They allow our research team to do things that we couldn't have done on our own. They're very curious and help us think of new research questions. They're very passionate and committed to public health. It helps to have as many passionate, dedicated people working with us as possible, and the Lerner Center fellows really do help with that. I think about how persuasive words and images can be. If you can reach someone and communicate to them in a language that they're comfortable with and that they know and that reflects their culture, I think you can encourage more positive behaviors. That's what most people should know about us here at the Lerner Center, that we really are invested in improving community health. We're not just studying it from a distance.
I'm Bryce Wong. I'm a Lerner Fellow here. I'm in the Socio-Medical Sciences Department for the Masters of Public Health here at Mailman, and my certificate is in Applied Biostats. Working with Lerner faculty has been pretty amazing. They always have these new ideas and interesting ideas that I hadn't thought of before. And it's been really eye-opening to see that happen in real time. A lot of what the Lerner Center is doing is cutting edge. We're redefining the game in terms of health promotion using health communication. This summer, I worked on Danny's tobacco advertising project. After working as specifically a research fellow for the Lerner Center, I got a better idea and excitement for the whole research process. And now I want to work more with the research community. The great thing about being a Lerner Fellow is that you can be diverse. They come from all different backgrounds. They come with different ideas that they want to study or explore. They're all super curious. They just want to learn, to ask questions, and they want to do things that they haven't done before in a field like public health. A lot of what you're doing is trying to understand how the behaviors and subjective experiences and perceptions of people are impacting their ability to access knowledge, resources, and their own health. And I think that if I had that ability to get into a room and sense the emotional valence, I'd be able to better understand how to help people.
My name is Abalu. I'm in the MPH program here at Mailman in the Health Policy and Management Department, and I have a certificate in health communication. So I came into this position wanting to learn more and what we can do to challenge societies to get involved, to change the way we view health. From a very young age, I'd always been interested in health promotion and health advocacy and just curious about how I can better my health. So I want to use this opportunity to learn as much as I can about public health promotion, and public health advocacy, and help people make more informed choices about their health. I feel like one of the greatest public health challenges is a lack of information. So providing people with the necessary tools they can use to inform their health decisions and inform their health practices, I think will help bridge the gap of the lack of access to information and the lack of access to the necessary resources they need.